The operating theatre is a potentially hazardous environment, and the surgeon has responsibility not just for the safe conduct of the operation itself, but for the safety of both the patient and staff in theatre. Last but not least is the surgeon's responsibility for his or her own personal safety within the operating room. There are many hazards within an operating theatre environment, but surgeons should be especially aware of those from sharp instruments, electrosurgery, ionizing radiation and blood-borne infections. Electrosurgery will be dealt with in a separate part of the basic surgical skills course and will not be considered further here. Although ionizing radiation is largely the responsibility of the attending radiology staff, surgeons should be aware of the potential hazardous effects, ensuring that they take avoiding action and wear appropriate lead-lined clothing where there is a risk of exposure. The surgeon should also be aware of the general principles of infection control. These include hand washing, the use of protective clothing, the management of waste generated during procedures, and the cleaning, disinfection and sterilization of instruments and materials. These principles apply in the operating theatre as they do in all areas of surgery. We're all well aware that hand washing is important, but it is particularly important between each patient contact at ward level and in the operating theatre. Hand hygiene is something which most doctors take for granted and is thus not given the attention that it merits. This slide shows the areas of the average hand which are typically missed during a hand washing procedure. It is particularly important during a surgical scrub that attention is paid in detail to these areas. To protect the surgeon from infection, it has been suggested that we should consider every patient an infection risk and embrace the concept of universal precautions. This means that the blood and body fluids of all patients should be considered infectious and appropriate precautions taken. This is a departure from the traditional practice of considering only certain individuals to be high risk, and a move towards a new practice where we identify high-risk situations in which the likelihood of contamination is high. This is particularly relevant in terms of transmission of blood-borne viruses to healthcare workers, and the commonest methods of transmission are shown on this slide. The risk assessment of patient encounters is shown here. In the operating room, there is likely to be contact with body fluids in most procedures, and a high risk of splashing in any kind of open surgery. Personal protection is provided in all operating theatre environments and should be worn by staff as appropriate to the risk of exposure. It should be noted that it is the personal responsibility of the individual to use the equipment provided. Failure to do so would prejudice against an individual in the light of any dispute. Notwithstanding the use of protective equipment, it is very important that surgeons and nursing personnel, particularly those at the operating table, take special care with the handling of sharps. Great attention should be exercised in the transfer of sharp instruments from one individual to another, and no two individuals should handle the same sharp instrument at the same time. This transfer is most easily achieved by placing the sharp instrument into a bowl or kidney dish for handover. Where a sharps injury occurs, and this will occur from time to time even in the best regulated of environments, it's important to be aware of the appropriate action that should be taken. The injury needs to be assessed as to the depth of penetration, whether the sharp instrument was clean or contaminated with blood, and in particular whether a hollow needle was involved in the injury. In this situation, it is important to assess the patient risk level. For example, is the patient a known intravenous drug user or known to carry a blood-borne virus? The injured area should be allowed to bleed freely and should not be scrubbed, as this may encourage deeper penetration of the contaminant into the tissues. The injury should be reported to the Occupational Health Service, and the injured party should undergo blood testing following appropriate counselling. If there is particular anxiety, the original patient may be considered for blood testing, but only after appropriate counselling and consent is obtained. In summary, the operating room is a potentially dangerous environment, with all the individuals within it exposed to risk. Simple precautions can minimise the risk to each individual and prevent cross-infection or injury to patients and staff. Surgeons should remember the importance of hand washing and adopt the routine use of universal precautions. Proper sharps handling should prevent injury, but in the event of an incident, surgeons should be aware of the proper course of action. The risk to all personnel in the operating theatre should never be underestimated.